Well, I don't know about y'all, but this Medicare stuff, it feels like a whole mess of letters and numbers and not a lick of sense.
That's exactly why we are here, Sam, and why we put this video together. For people like you who are looking for clear and honest answers about Medicare.
We know how overwhelming it can feel at first, but we promise by the end of this you'll understand your options and you'll feel confident knowing you're making the right choices for yourself.
Well, I sure hope so. I've had just about enough of these flyers tell me everything's free and then fine print saying otherwise.
That's the thing, Sam. There's a lot of noise out there, but not a lot of clarity. Our job is to cut through the noise and show you what really matters.
And most importantly, you'll know this. We work for you, not the insurance companies. Our only goal is to help you make the best decision for your healthcare and your budget.
Well then, let's get started before I get any more gray hairs.
You got it, Sam. Let's dive into Medicare 101.
Well, if this ain't a mess of alphabet soup. Part A, Part B, C, D, I don't know if I'm getting insured or learning my ABCs.
You're not alone, Sam. A lot of folks feel the same way when they first see all this.
That's why we're here, to make Medicare make sense.
Medicare is a federal health insurance program. It's mainly for people age 65 and older, but it also covers younger individuals with certain disabilities or end-stage renal disease.
Think of it as your foundation for health coverage in retirement, but like any foundation, you might need to build on it depending on your needs.
Okay. So what exactly am I looking at here, with all these parts?
Great question. Medicare has 4 main parts. Let's walk through them.
Part A is your hospital insurance. It covers inpatient hospital stays, skilled nursing care after a hospital stay, hospice care, and some home health services.
And here's the good news. If you or your spouse paid into Medicare through payroll taxes for at least 10 years, you usually won't pay a monthly premium for Part A.
Well, that's one less thing to worry about.
Part B is your medical insurance. It covers outpatient care like doctor visits, preventive screenings, lab tests, physical therapy, even durable medical equipment.
There is a monthly premium for Part B. In 2026, the premium is $202.90, and Part B also has an annual deductible of $283 before coverage kicks in.
After that, Medicare generally pays 80% of approved costs, and you cover the other 20%.
That is why, with Original Medicare, people usually pick up a Medicare supplement plan to pick up that 20%.
I know I wouldn't want to pay 20% of my medical bills, so if I'm understanding you, this part helps with all the stuff outside the hospital walls?
Exactly. Think of it as your day-to-day coverage.
Part C is known as Medicare Advantage. It's an alternative to Original Medicare, offered by private insurance companies approved by Medicare.
It bundles Part A and B and often includes Part D and extras like vision, dental, hearing, and even gym memberships.
Some even throw in a nurse hotline, but we'll get to the pros and cons later.
Part D is for prescription drug coverage. If you stay with Original Medicare, you'll need to add a standalone Part D plan.
These plans change every year, and it's very important to review. We help with that process for all of our clients. We can help you take a look at every plan available with a single phone call.
Okay. A is for hospital, B is for doctors, C is for Advantage, D is for drugs. Got it.
But here's the important part. Medicare doesn't cover everything.
It doesn't cover routine dental, vision, hearing aids, or long-term care.
That's why many folks add supplemental coverage or choose a plan that fills those gaps.
You know what? That makes a whole lot more sense than those pamphlets.
Stick with us, Sam. We're just getting started. Let's talk about how to sign up for Medicare, because the rules are different depending on your situation.
If you're already getting Social Security or Railroad retirement benefits at least 4 months before your 65th birthday, good news. You're automatically enrolled in Medicare Parts A and B.
And your red, white, and blue Medicare card should show up in the mail about 3 months before your birthday month.
Wait, so I don't have to do anything?
Not if you're already collecting benefits. But if you're not receiving Social Security yet, you'll need to sign up yourself.
And the easiest way to do that? Online at ssa.gov or you can call or visit your local Social Security office. When you apply, you'll need basic info like your Social Security number, current or past job details, and any other health insurance coverage.
Now, here's where folks get into trouble. Some assume they'll be auto-enrolled when they're not, and they miss their initial enrollment period.
And that could mean lifetime penalties or a gap in coverage.
But no worries, we're here to make sure that doesn't happen. We'll walk you through the whole process, make sure your timeline is right, and help you avoid the common pitfalls.
And remember, we don't charge a dime for our help with signing up. It's all about giving you peace of mind. We do it all the time, so just give us a call.
Okay, fellas, I keep hearing about this initial enrollment period. Is that when I got to sign up for Medicare or what?
Exactly, Sam. Your initial enrollment period, also called your IEP, is your first chance to enroll in Medicare. It's a 7-month window that surrounds your 65th birthday.
It starts 3 months before the month you turn 65, includes your birthday month, and goes 3 months after. So, for example, if your birthday's in August, your IEP runs from May through November. That's your golden window to get enrolled without penalties or delays.
All right, I follow. But what if I wait too long?
If you don't sign up for Part B or Part D during your IEP and you don't have other credible coverage, you could get hit with permanent penalties and have to wait for the next general enrollment period.
And if you enroll early in those 3 months before your birthday, your coverage starts the month you turn 65. But if you wait until your birthday month or later, there could be a delay in when your coverage kicks in.
And here's a little known twist. If your birthday is on the first of the month, Medicare treats it like you were born the month before. So your IEP starts and ends 1 month earlier, and your Medicare begins a month earlier too.
Well, I'll be. That's a sneaky one.
Missing your IEP isn't just about money. It could mean gaps in your healthcare coverage. That's a big deal, especially if you need ongoing care.
That's why we're here. We help folks track their IEP, confirm their timelines, and make sure nothing slips through the crack.
Whether it's signing up or choosing the right plan, we make sure you're covered and confident. No stress, no penalty surprises.
Now hold on a minute. I ain't retired yet. Still punching the clock every morning. Do I still need to mess with Medicare at 65?
If you're still working and have health insurance through your employer, or your spouse does, and that employer has 20 or more employees, you may be able to delay enrolling in Medicare Part B without a penalty. But here's the key. Part A is usually free, so if you're not contributing to a health savings account, it often makes sense to go ahead and sign up for Part A at 65.
But don't touch Part B just yet. That premium is $202.90 a month in 2026. If your work insurance is solid, then there is no reason to double up.
And here's the kicker. Once you stop working or lose that employer coverage, you have an 8-month special enrollment period to sign up for Part B. No penalties if you time it right.
All right. But how do I sign up for Part B later without jumping through hoops?
That's where 2 forms come into play. You'll need Form 40B for yourself and Form L564 from any employer you had coverage from over the age of 65. Form CMS 40B, that's your actual Part B application. Form CMS L564, your employers fill this out to prove you had creditable coverage. You submit both forms together to Social Security. Online, by fax, in person, or even by mail. We walk our clients through the whole process to make it easy. Now listen closely. COBRA and retiree plans don't count as active employer coverage for delaying Part B. If you skip Part B and go on COBRA thinking you're covered, you could get hit with a penalty down the road.
Same goes for Part D. That's your drug plan. If you're losing drug coverage, you only have 2 months to sign up for a Part D plan or face penalties there too.
That's why we say don't guess. If you're working past 65, talk to us first. We'll map out the smartest path forward based on your job, your coverage, and your plans.
Boy, oh boy. Y'all just saved me a pile of stress and paperwork.
That's what we're here for, Sam. No sales pitch, just solid help. Now let's get that truck up and running.
So I found a plan online that says I can sign up this month. Should I just go ahead and sign up to get this over with?
Not so fast, Sam. You should really wait for your official Medicare card before making any plan decisions.
That card tells you your Part A and Part B effective dates. And every Medicare plan, whether it's a supplement or Advantage plan, depends on those dates.
See this number here? That's your Medicare Beneficiary Identifier, your MBI. Insurance companies use it to verify your eligibility. Without it, they can't process your application.
If you enroll too early or submit an incomplete application, your plan could be denied or delayed.
What if the card doesn't show up in time?
Good question. If you're already getting Social Security, your card should arrive around 3 months before your 65th birthday. If you signed up manually, it'll come after your application is processed. Just takes a little patience.
Once it shows up, we can help you compare plans that match your exact start date, without guesswork.
At Proven Insurance, we never submit your plan paperwork until we've seen your Medicare card. That way, everything's aligned and you avoid any costly mistakes.
Think of it like a prescription. You wouldn't take the meds until you know what you're treating. Same with Medicare.
All right. I'll hold my horses. I'll wait for that card. I've got parts A and B down, but I'm still not clear on what they're going to cost me. I thought Medicare was supposed to be cheap.
That's a common misconception, Sam. Medicare does help a lot, but there are still costs involved, and it's good to know what to expect.
Let's start with Part A, which covers hospital stays. If you or your spouse worked at least 10 years and paid into Medicare, the monthly premium is usually $0.
Thankfully, most people qualify for a $0 premium on Part A.
There are deductibles involved with Part A that revolve around benefit periods, but thankfully, most supplemental or Medigap plans will pick up those costs.
We don't need to bore you with numbers that are going to be covered anyway by the right supplemental plan. Now let's talk Part B. This covers doctor visits, outpatient care, labs, imaging, preventive services.
In 2026, the monthly premium is $202.90, but that changes every year. If you have an IRMA, it will be different as well. We will cover that in a moment.
The deductible for 2026 is $283.
It's only $283 for the entire year? So no out-of-pocket maximum or co-pays and co-insurance?
As long as you have the right supplement coverage. You will pay your premiums and then your deductible. That's it.
It's also important to know what's not covered by A and B. That includes prescription drugs, dental, vision, hearing aids, and long-term care.
That's why the choices you make after getting Parts A and B matter so much. We'll help guide you through those next.
All right, now I'm starting to see the bigger picture. So parts A and B cover about 80% of the medical costs, and the supplemental policy would pick up the difference.
We told you that this would all make sense.
Let's talk about something that surprises a lot of folks when they sign up for Medicare. It's called an IRMA, short for Income-Related Monthly Adjustment Amount.
An IRMA is an additional charge added to your Part B and Part D premiums if your income is above a certain threshold. It's based on your modified adjusted gross income from the past 2 years.
So if you are signing up for Medicare in 2026, then Social Security will look at your tax returns for 2025 and 2024 to decide if you owe additional premiums for Parts B and D.
These change from year to year as well, but in 2026, the IRMA amounts are $109,000 for single filers and $218,000 for filing jointly. Anything less than that, and you won't have an IRMA.
I got a letter saying I would be paying $202.90, but I made over $109,000 in 2024. Shouldn't I have an IRMA?
That's right, Sam. The standard letter goes out showing the base premium, and usually within a week, you will receive a second letter that includes your IRMA.
Make sure to keep an eye out for that second letter, because it is important we know about an IRMA. There are multiple tiers above the standard rate depending on how much you have made.
But I just retired. I'm not making anywhere near that now.
And that's where the good news comes in. If your income has dropped because you retired or due to another life-changing event, you can appeal the IRMA decision.
To appeal, you'll use a form called SSA 44. It tells Social Security that your current income is lower than what they're using.
Common qualifying events include retirement, loss of a spouse, divorce, or reduced work hours. Along with the form, you'll submit proof, like a retirement letter or updated financial records.
And don't worry, you don't have to do this alone. Helping folks with IRMA appeals is something David and I do all the time.
Well, that's a relief. I thought Uncle Sam was going to keep digging deeper into my pockets.
Not on our watch, Sam.
If you ever get hit with an IRMA and it doesn't reflect your current income, we'll help you get it sorted out. Just give us a call.
All right, Sam. Once you've got Medicare Part A and B in place, it's time to make your biggest decision: how you want to get the rest of your coverage. There are two main routes to choose from, and they couldn't be more different. First up, Original Medicare plus a supplement plan and a separate Part D drug plan.
This is also called the Medigap path. You keep Medicare as your primary coverage, then add a supplemental plan that helps pay your deductibles, coinsurance, and other out-of-pocket costs to fill in the gaps left by Medicare.
And because it works with Medicare, you can see any doctor nationwide who accepts Medicare. No networks, no referrals.
Well, I like the sound of that. Choosing my own doctors is important to me. But what about my prescriptions?
You would need to add a separate Part D plan for that. It gives you full coverage across hospital, doctor visits, and medications.
Now, let's talk about your second option, Medicare Advantage, also called Part C. These are private insurance plans that replace Original Medicare.
They usually bundle in drug coverage and add extra benefits like dental, vision, hearing aids, and gym memberships. You get all of the bells and whistles.
Just remember, you are no longer under the care of Original Medicare with these plans.
So what's the catch? Some of those plans hardly cost a thing.
That's the tricky part. The monthly premiums might be $0, but you'll usually have copays every time you see a doctor, higher deductibles, max out-of-pocket costs, and you're limited to a network of providers.
Plus, many Advantage plans require prior authorizations for tests, surgeries, or referrals. So the insurance company decides whether or not something is medically necessary.
Well, I wonder why they never told me any of that in the commercials.
Now here's something agents or brokers won't tell you. Insurance companies pay us up to 3 times more to enroll someone in an Advantage plan than a Medigap plan.
But we don't have anything to hide. Our job is to lay out both paths fairly so you can decide what's best for you, not what's best for an insurance company, and definitely not what is best for your agent.
Wait a darn minute. You're telling me the cheapest plans actually pay you more to sign me up?
That's exactly what we're saying. And that's why we show you the full picture. Because a lower premium today doesn't always mean lower cost overall.
When we help clients make this decision, we look at your budget, your doctors and hospitals, your travel plans, your prescriptions, and your overall comfort with the plans available.
And keep in mind, once you go on an Advantage plan, switching back to a Medigap plan later may require medical underwriting. That means they can ask about your health and potentially deny you.
They don't usually let you buy homeowners insurance when the house is already on fire or buy car insurance after an accident. It's the same for health insurance outside of your IEP or a guaranteed issue.
So one path gives me control and has a set cost each month. The other one's cheaper up front, but comes with oversight and additional costs.
You got it, Sam. Neither one is right or wrong. It's just about what works for your lifestyle, your health, and your peace of mind.
And no matter which route you take, we'll walk it with you. That's what we're here for.
All right, Sam. Now that you've got parts A and B, let's talk about one of your 2 main coverage paths, Medigap, or as it's also known, Medicare supplement insurance.
Medigap plans help cover the costs that Medicare doesn't pay, like co-payments, co-insurance, and deductibles. You can think of it like a backup plan for your wallet.
Well, I'm not a big fan of surprises, and thus their birthday cake. What are the perks?
First off, you can see any doctor nationwide who accepts Medicare. There are no networks. You want to see a specialist in another state? No problem.
Second, predictable cost. You'll pay your monthly premium, and depending on which plan you choose, that's it. Plan G, for example, covers nearly everything after your Part B deductible.
Okay, sounds solid so far. What's the catch?
Well, you do pay a higher monthly premium compared to a Medicare Advantage plan. You also need to enroll in a separate Part D plan for prescription drugs. That's not bundled in.
And Medigap plans don't include dental, vision, or hearing coverage. If those are important to you, you may want to look into standalone policies.
There's also one more important note. Depending on your state, switching Medigap plans later might require medical underwriting. That means you could be asked health questions and possibly denied or charged more.
That is why we picked the right choice the first time. Choose wisely and you may never have to change plans again. Rest assured, though, if something better is available, we will call you to make the switch.
So it's a bit more upfront, but fewer hassles later on.
And don't forget, doctors who take Medicare already know how the program works. We know what Medicare considers medically necessary, and we know how to document it. You won't find yourself fighting to get treatments covered just because you switched plans.
That's right. Medicare's been around for decades, and providers are used to working within it. If your doctor takes Medicare, they're experts at making sure your care meets the requirements to get approved.
Well, now that's good to know. I like knowing the folks taking care of me know how to make it all work.
Exactly. And if freedom of choice and peace of mind are top priorities, a Medigap plan might be the best fit for you. Now, keep in mind that all of the lettered plans are the same. A Plan G is Plan G across the board. Every company has to have the same benefits.
That's right. Medigap plans are standardized by law. So if an insurance company sells Plan G, it has to include the exact same core benefits as any other company selling Plan G.
Wait, you mean Plan G from ABC Insurance is the same as Plan G from XYZ Insurance?
Exactly, Sam. The only difference between companies is the price, customer service, and rate history, not the benefits. The medical coverage you get is identical.
That's one of the best things about Medigap. It's simple and predictable. Every lettered plan like G, N, or F is standardized. If a company offers Plan G, they have to cover everything that Medicare covers, the same as every other company who offers one.
So don't be fooled by slick marketing or big logos. Our job is to compare all the companies offering Plan G and help you find the best price and the most stable rate increases.
Well, that's good to know. No hidden fine print between companies?
Nope. No hidden differences. Plan G is Plan G. You just want to make sure you're getting a competitive premium and working with a company that treats its customers right.
Now let's recap what makes Plan G so popular. After you pay your small annual deductible, Plan G covers all the rest of your Medicare-approved costs. No networks, no surprises.
Some people ask about Plan N, which has a slightly lower monthly premium, but Plan N comes with copays for doctor and ER visits, and it doesn't cover something called Part B excess charges.
Part B excess what now?
Excess charges. See, doctors who don't accept Medicare standard rates can legally charge up to 15% more, and those costs are on you if you're on Plan N. And guess what, Sam? Some of the most expensive cancer treatments and specialty care often come with those excess charges.
That's why so many of our clients pick Plan G. You pay a little more each month, but you avoid those big unpredictable bills if you get sick.
So, higher premium but fewer headaches, and it doesn't matter who I buy it from. I like that.
That's why it's the most popular choice for a reason, Sam, and we'll help you shop smart.
Okay, Sam, let's talk about something everyone asks us sooner or later. Why does my Medigap premium keep going up?
The short answer? Healthcare costs keep going up. Every plan sees increases because of medical inflation. But how your plan is priced and how much it goes up depends on which pricing model the insurance company uses.
There are 3 common ways companies price their Medigap plans. Let's walk through each one.
With issue age rated, your premium is based on the age you are when you sign up, and it stays at that level. The only increases come from medical inflation each year.
So if you enroll at 65, your rate stays at the 65-year-old level, plus a small bump each year for inflation.
Well, that sounds steady.
It is. That's why it's one of our favorite options when it's available.
Next up, community rated. Everyone in your area pays the same premium no matter how old they are.
The only company in North Carolina that offers community-rated Plan Gs is United Healthcare. They give you a discounted rate for signing up earlier.
They take back that discount over time a little bit each year.
So if the discount was, say, 36%, then over a 12-year period, they would take back 3% per year.
That isn't exactly how the numbers work out, but it gives you a rough idea of how the plan raises their rates.
In this case, the rate will go up by United Healthcare's medical inflation, plus the increase of them taking away a portion of the discount.
In our opinion, this is the second best way a company can do a rate increase. Issue age being the best, and then community rated a close second.
Ah, so it starts off looking real cheap, but it climbs for a while before it steadies.
Exactly. That's why we help you weigh the long-term math, not just the price tag on day one.
And finally, attained age rated. This one starts you at a lower premium when you're 65, but it goes up every single year just because you're older, plus inflation.
So every birthday comes with a rate hike.
Well, happy birthday to me.
Right. And over time, it usually ends up being the most expensive.
This is why it's so important not just to shop for the cheapest premium today, but to look at how the company raises rates over time.
That's what we do for you. We compare rate histories, stability, and pricing models to find what fits your needs, not just this year, but years from now.
So cheaper now might cost me more later.
That is why we help you through this process. We want to make sure you make the best decision on the way into Medicare. That way you don't have to worry throughout.
I know the last thing I want to do in retirement is have to review my health insurance year after year.
Yeah, I want something that is going to last me my lifetime. And those Medicare supplemental plans seem to be built to last. Just not those attained age plans. I don't want to be charged more for getting older. I can't help it. It just keeps happening. So what about these Medicare Advantage plans I keep seeing on TV? Says here they barely cost anything. Sounds like a pretty good deal.
Sam, we're going to be straight with you. We're not the biggest fans of Medicare Advantage overall, but that doesn't mean it's never the right choice.
That's right. For some folks, depending on their situation, budget, health needs, even personal preference, Advantage plans can make sense.
Our job isn't to push you one way or the other. It's to lay out the facts so you can make the decision that's right for you. After all, it's your healthcare and it's your choice.
Let's start with the good. Medicare Advantage plans often come with very low or even $0 monthly premiums.
They usually include prescription drug coverage built in, and many throw in extras like dental, vision, hearing, and even a gym membership.
They also have an annual out-of-pocket maximum, so there's a cap on how much you can spend each year. For healthy people who don't visit the doctor often, it can keep monthly costs low.
Now for the trade-offs. These plans have networks. That means you're limited to certain doctors and hospitals.
Want to see a specialist? You'll probably need a referral, and some treatments require prior authorization, which can delay your care.
Uh-huh. So if I get sick,
That's where it can get expensive. You'll pay copays and coinsurance along the way, and those costs can really add up if you need a lot of care.
And don't forget, Advantage plans can change their benefits, networks, and drug lists every year. What you have today might not be what you get next year.
so why would anyone choose one?
Because sometimes it really is the right fit. If keeping your premium as low as possible is the most important thing, or if you're generally healthy and don't need much care, it can work.
But here's what you need to know. Insurance companies actually pay brokers more to sign clients up for Advantage plans than Medigap, up to 3 times as much actually.
Well, now that don't seem right.
That's why we make this promise to our clients. We don't recommend anything just because it pays us more. Our loyalty is to you, not the insurance company.
At the end of the day, Sam, it's your healthcare, it's your decision. We're just here to make sure you understand your options.
Well, I sure do appreciate that, gentlemen. Gosh, my prescriptions are costing me more than my groceries. It was so cheap last year. Why is it so darn expensive now?
Good question, Sam. Let's talk about why reviewing your Part D plan is so important every single year.
Medicare Part D is your prescription drug coverage. If you don't have it or another creditable plan, you'll pay a lifetime penalty.
But here's the tricky part. Part D plans aren't all the same, and they change every year.
Plans are different in every zip code. Drug formularies, meaning which medications are covered, change every year. Pharmacies drop out of preferred networks. Even your own medications can change.
So if you just stick with the same plan year after year without checking, you could end up paying way more than you need to.
Well, heck, I thought once I picked a plan I was good forever.
That's what a lot of people think. But that's why we call every one of our clients every year to make sure nothing slips through the cracks.
No one should be paying more for the drugs they need than they have to, period.
We run your medications, your pharmacy, and your zip code through our tools, then show you the plan that saves you the most.
And we handle the paperwork, so it's easy. You just pick the best fit, and we take care of the rest.
Well, now, that's one less thing for me to worry about.
That's the idea, Sam.
We're here to make sure you only pay what you have to, and not a penny more.
Well, fellas, I gotta say, Medicare doesn't seem near as scary now. Y'all really made sense of it all.
That's what we're here for, Sam. Medicare has a lot of moving parts, and it's normal to feel overwhelmed. But you don't have to figure it out alone.
Every person's situation is unique, and that's why we take the time to sit down one-on-one. We work for you, not the insurance companies, always.
Can't argue with that.
There's no pressure, no obligation, and no extra cost to work with us. The insurance companies pay us, so you don't have to.
All you have to do is give us a call. We'll walk through your situation step by step at your pace and make sure you're not paying more than you have to or leaving yourself exposed.
Our business relies on us earning your referral, so tell a friend about us, and if you wouldn't mind subscribing to our YouTube channel and liking or sharing our video with someone you know who could use a little Medicare advice, it goes a long way and helps us do more of what we love, helping people.
We are going to be putting out more videos and content to help everyone understand Medicare the way it should be understood. No one should feel pressured or uninformed about a decision as important as your health care. So from our family to yours, we would like to say thank you for watching, and we hope you have a wonderful night.